Good afternoon to everyone. My name is Hugo Caires, and today I'm bringing to you the development of a clever technology that may change the way we treat leukemia patients. I will start with something that we simply cannot live without, and that is our blood. As most of you know, our blood is composed by red blood cells, which carry oxygen, white blood cells, which fight infections, and platelets, which prevent us from bleeding out. What some of you may not know is that all of these cells are continuously produced within our bones in a place called bone marrow by one specific type of cells called progenitor cells. The leukemia is a type of cancer that affects these progenitor cells, which will now not be able to manufacture any new healthy blood components. From different types of leukemias, one of the most frequent and the most aggressive form of this disease is called acute myeloid leukemia, or AML. From the 352,000 patients with AML, 75% will die in less than 5 years. And why is that? Now, I want you to imagine that you are one of the 130,000 persons that will be diagnosed with AML this year. Just imagine. The first thing your doctor does to you is to check for your bone marrow for signs of cancer. And for that, he will drill into your hip bone using a large needle to extract a small sample to confirm the diagnosis, using a painful procedure called bone marrow biopsy. When it turns out positive for AML, you are immediately treated with intensive chemotherapy to get rid of the leukemia cells. Then, your doctor performs another 2 painful bone marrow biopsies to check if there are any leukemia cells left after treatment. And for 80% of you, this test shows no signs of disease. Well, nevertheless, within a few months later, half of you will suffer from aggressive relapse of disease, which means that after the first treatment, you actually had cancer, but it just did not show up in the painful bone marrow biopsy exam, most likely because you were drilled in the wrong spot. As you might imagine, this poses a big problem. Not only the bone marrow biopsy exam is a painful, expensive, and complicated surgical procedure, which limits the frequency of monitoring to only 4 times a year, but also 50% of the test results are actually false negatives. For you, this means that while you are at home, untreated and unwatched, you're actually giving the chance for the few undetected leukemia cells to recover and grow even stronger, and they will put you down later on. And this is why AML is so deadly. So there is increasing demand for alternative residual disease detection methods on the patient's peripheral blood. This will allow for an easier, more frequent, and representative monitoring of all the disease that is left after the treatment. Within this blood test approach, the analysis of circulating exosomes holds great potential for residual disease determination. And what are these exosomes? So exosomes are tiny little particles that are continuously released from all cells towards the bloodstream for cell communication. But most importantly, these exosomes not only carry all sorts of medically relevant information, but also have a unique fingerprint that allow us to backtrack them to the cell of origin. So in CLEVER Diagnostics, we found a way to use this unique leukemia exosome fingerprint to provide 2 important insights on the patient's disease. First, the CLEVER scope uses the abundance of these leukemia exosomes in your blood to tell us how much disease is still present within our body. And then, secondly, it analyzes their content to inform us which will be the most effective therapies to kill the remaining leukemia cells. Based in this technology, we provide a service that monitors the progress of the treatment as it's going on, and then we forecast the amount of time that it will take for you to relapse, and advise on the best therapeutic options to avoid it. And even after therapy, we will continue monitoring you for a full year to make sure that your leukemia is still in remission. Therefore, unlike our competitors who struggle to detect the presence of minimal amounts of residual disease in an uneven bone marrow biopsy sample, CLEVER technology spots the presence of minimal amounts of disease in the patient's blood by exploring the abundance of exosomes that are released by the hundreds by the few leukemia cells that are spread out throughout your body. Regarding the pricing, as the CLEVER-Scope technology does not rely on the painful and expensive bone marrow biopsies, we provide a much closer follow-up of the patient's disease throughout the full year at a fraction of the price that is spent today. Regarding our roadmap, we will continue on perfecting the CLEVER-Scope test accuracy until the end of 2020 to secure a definitive patent before entering clinical trials both in US and Europe. These will take for 2 years before launching the CLEVER-Scope service in both of these markets. And for that, we ask for an investment of 10 million euros. Our focus will be the AML growing market, where nearly all the patients spend about 1.5 million euros a year in residual disease determination. And by running these numbers, we project to obtain a break-even in 2023, generating 33 million euros in revenues by 2025. It's important to notice that while we are bringing our solution to the market, there is a great interest by larger companies to acquire startups that operate in exosome diagnostics space like we are. And just like Exosome Diagnostics was recently acquired by $250 million, we also anticipate it's possible to be acquired within the first few years after clinical trials. So I hope I was able to convince you that our vision, aligned with the team's entrepreneur spirit, scientific excellence, and clinical experience, grant us a good opportunity to provide to the next generation of hematologists the chance to intervene therapeutically in an informed, timely, and clever fashion to avoid the needless suffering from disease relapse. So thank you.